Hi, my name is Deidre Gowdy, and my presentation is based on improving management of cardiac conditions in the Brown Deer School District community. This community assessment targets collecting accurate data that will accurately reflect the needs and demands of the community. Therefore, the assessment will begin with evaluations before taking the actual actions. In this case, the assessment plan will be able to give the current community condition and identify the issues that need attention. Also, this will establish the basis for effective making of decisions. This community assessment plan covering Milwaukee, Wisconsin, the Good Hope Road in Sherman Avenue, and how they are part of a larger economic and social context and the assessments functions in the healthcare system. Also, I will be covering the Brown Deer School District area as part of my community of focus. Definition of community. Milwaukee ranks number 30 among the largest cities in the U.S. as the largest city in Wisconsin. Milwaukee has a population of 503,000 people, although this has decreased by 1.40% since 2010. Besides, Milwaukee is among the densely populated cities in the U.S. Most of the companies in the city are locally owned and operated, which represents the biggest part of the employment. In the demographics, Milwaukee comprises different races, including whites and blacks. The population is large and comprises 55% whites and 27% blacks. The unemployment rate in the city is also high, with young people having the highest percentage. Windshield survey. The windshield survey has helped me understand the factors influencing the population's health where I live. My neighborhood is a safe place for raising families. Besides, there are good infrastructures and services with stores and parks to serve the population. However, there is a problem of heart disease among children with obstacles due to the lack of preparation from schools. Therefore, there is a need for schools and parents to be prepared by preparing food with fiber and creating an environment where students can benefit. The neighborhood is favorable and children can safely walk to and from the school without any obstacles. Data generation. The research conducted includes observing the health factors affecting children in a certain region in northern Milwaukee, which is Brown Deer School District in Wisconsin. The project was conceived and implemented at Brown Deer Middle High School because it was favorable facilities for the research. It has favorable facilities for the research, I'm sorry. However, the data collection process was challenging because of the infrastructure and location of the school. The limited variances were a threat because of the possibility of making errors in the results and conclusions. During the examination of collected data, researchers enjoyed the input from community members and stakeholders who cooperated incomes. And those researchers, for one of them, were me. Community partners and resources. In this case, important community partners who provided resources include Project Adam, whose primary mission is to prevent the cases of cardiac arrest among children, saving their lives. Others include Concordia University, which was active in contributing their clinical students to the facility to implement Project Adam with AED presentation video at the school. The university also provides exceptional care in sick children and supports them with their parents while focusing on cardiac issues. The North Shore Fire Department has a child safety program introduced in automobiles. And also, the North Shore Fire Department is probably about 5 minutes away from the school, so it takes them about 3 to 5 minutes to respond to emergencies at the school, which is pretty doable in a sense, in case of an emergency. Um, Also, the Children's Hospital is majorly concerned with child-related problems. These organizations are critical in ensuring that child safety is ensured and protected in the community. Diagnosis. The diagnosis that I came up with was decreased cardiac output in kids with congenital cardiac diseases. The school has introduced new facilities that make the environment friendly to students. These facilities, including the playground, are recommended for the students who have problems with their hearts. Others include advanced infrastructures ideal for those with special needs in the school. However, there is a lack of experience among the staff concerning handling cardiac patients. In this case, there is a need for an investigation among the teachers based on the school's new infrastructures and other learning issues among the students with congenital heart conditions. Please note, brain damage could begin after only 4 minutes without oxygen. It is important to be prepared for this type of emergency. Short-term goal objective. The patient will have normal vital signs, adequate cardiac output, no dysrhythmias, and no indicators of heart failure. Angina and dyspnea will be reduced in the patient. Participation in activities that minimize the patient's heart workload will be encouraged. Note, after completion of the education session, students will verbalize 3 healthy snack options. Long-term goal objective. 6 months after the education session, the school will be able to reduce the incidence of brain injuries among cardiac patients and cyanotic attacks by applying appropriate resuscitative measures from 60% to less than 5%. Community health plan. Schools are required to sensitize the staff on establishing the new symptoms of cyanosis and, dyspnea for patients with cardiac problems. Also, sensitization should cover the effects of weather and exercise. Besides, it is vital to apply medical methods and new technologies. Teachers should not be free to access medical information. In this case, they will be able to inform the school about the student's medical conditions, including prescriptions, doses, and usage. A critical long-term objective is to minimize the risk of brain injury in cardiac patients with cyanotic issues. This target is possible with the help of tactics in place. Now, at Brown Deer Middle and High School, there is their district nurse that handles all medications. She helps the school prepare CPR interventions for children in times of an emergency for anybody, whether it's the faculty, staff, or the students, or the parents. The district nurse that I worked with was my liaison, and she helped me to focus in on what was most important for my implementation, which managing the care for children with cardiac conditions. And the biggest thing is just having an emergency plan in place, and that the only emergency plan in place that we could come up with, actually me, not we, I'm sorry, but that me and the school incorporated with each other, which is what they have already been doing, and that's CPR and AED training with the faculty and with the district nurse. Interventions. An important factor in this case is conducting an assessment of patients, which are the students, concerning their fears and other issues, as well as the parents as well, such as ascertaining their behaviors and the techniques they use in the process of coping with fear. The school shall install a security system placed around places such as showers in the locker rooms for one, in the gym area. Also, the use of community resources by the school is recommended. They will help both the patient and their families with their needs. The school needs an emergency plan to ensure that they address the patient's important services and needs. Verbal guidance will be specific for the patients in both levels 1 and 2. Evaluation methods. The evaluations that I came up with will involve the use of surveys in which the patients who have been in the emergency will be significant in gathering information about their experiences. So in this case, it will be based on the school system and how we implemented our safety measures like CPR and grabbing AED equipment in the time of a cardiac arrest emergency. Also, every employee involved in the incident will be allowed to take part in the survey. In this case, they will help provide information about the events that happened. Allowing people to give feedback is recommended as it will help enhance making more modifications. The use of surveys is an essential tool that stakeholders prefer in uncovering and assessing their commitment levels. In this case, surveys help gauge the attitudes, actions, and knowledge of the target audience. In conclusion, we know that there is a need for an emergency approach at the Brown Deer Middle High School District. CPR and AED training has been implemented and effective by students, parents, and staff in the event of emergency. And as well, I want you guys to know that Project Adam also is one of the main reasons why the Brown Deer School District and their community has improved with how they manage cardiac arrest emergency situations. um, Parents and staff have been able to provide teach back of cardiac arrest emergency plan with the brochures that I created. And I also wanted to um, talk with my liaison about putting an area on the school website for safety measures in children with cardiac conditions that parents or school faculty that may be new to the system and students can go on the website and learn about how to manage these incidents when they do occur. Conducting a community plan is crucial because it creates room for identifying the opportunities that will help improve the community. Besides the community assessment, it is the recommended way of getting an accurate picture of community health. In this case, the different challenges and difficulties are handled by identifying the care needs of the community. Therefore, in this case, the information will be significant in addressing the various issues to benefit people in the community. Conducting an assessment of the community's health is also a chance to ensure people's preservation and well-being.